I hope you're doing well. So today we are going to talk about diabetes. Okay, we are going to shine some light on this topic, and we will have amazing diabetes educator Melissa, and we'll be waiting for her. And hello, welcome. So while we're waiting for Melissa to join in, I'm going to introduce myself. My name is Anjali, and I am women's health movement coach and the nutrition counselor, and as well as the founder of this platform. So Mel is here. I am going to add invite. So let's see if Mel will come online. Oh, here she is. Hi, Mel.
Morning, how are you?
Morning. Good, thank you. How are you?
Good, thank you for asking me to come and chat.
Yeah, always. Every year it feels like it's it's when it's time to bring awareness in our diabetes areas, area. And I always think of you because you are so passionate about it. And so we would love to have you in here. Oh, what did I do just then?
There's four of you.
I don't know. How did I do that? Oh, well, okay. That's very interesting. I'm sorry. I'm glad I didn't choose the cat one. It's the filter. Yeah, I pressed it by accident. Okay, sorry, everybody. Hi, Meg. Meg is here. She's our beautiful hypnotherapist. Thank you for being here. So, Mel, let us know a little bit about you. Who are you and what you do?
So my name's Mel or Melissa. I'm a diabetes educator. So my nursing is my sort of primary trade, and then I've specialised in diabetes education many moons ago. So that's it in a nutshell. I could go on a little bit, but I support people with diabetes across the lifespan to learn about diabetes and how to manage it.
Yeah. Yes, I know. I remember your bio is so long that it's so much easier when you say it because you know how to shorten it. All right. Before we dive in, I just wanted to let everyone know that this is all about to bring awareness in on this topic and educational purposes, not a specific advice or suggestion to anybody. And if you have if you think, oh, what do you say, if you have any issues or any concern, please go and reach out to your healthcare practitioner, right? And would you like to add anything, Mel, in there?
No, that was great. So yeah, just a sharing awareness, which is what you do with your beautiful network. So yeah, if anyone has any worries or questions, they should reach out to their health professional. Yeah.
Yes. Or Mel, if they can reach out to you, right? All right. So let's start with so this week we're celebrating Diabetes Week. So what is the theme for this year?
So Diabetes Week is this week, so the 12th to the 18th of July, and it's something that Diabetes Australia does every year to raise awareness about diabetes for people. So this year it's living out loud with diabetes and becoming stronger together. So often one voice is hard to raise awareness, but when we all come together with our colleagues, our doctors, our nurses, our patients, people with diabetes, anyone that is impacted by diabetes, coming together to raise awareness about diabetes and how it impacts people who live with it every day. So diabetes is something that you can't see. It's not like a broken arm or a broken leg. It's something that's invisible.
Yes.
And over the years, particularly my clinical experience, it's something that's it's hard to manage for lots of people because it's not a physical thing that is visual that you can see. So
yes, you can't do the limping, right?
Yeah. So it's something that is invisible, and people carry a big load. So this year it's about speaking together, shouting out loud, and sharing the message of what people with living with diabetes would love other people to know, because just because you can't see it, it doesn't mean it's not there, and it's not a huge load to carry.
Yeah. No, I was thinking about, oh, I'm not impacted, but then I realized my grandfather used to have a diabetes.
Yeah.
And because we didn't have the access to nutrition or the dietitian, so our main staple food is rice, right? But then he could not eat. It almost felt like he could not eat anything because our staple food, he had to cut that out, and it was very hard for him to manage that, and as a family as well, we didn't know what we can give him or not give him, and but I guess when we talking about like this, and here is we have lots of resources and the access to practitioners, and so I feel we are in a better era, but we still need to, but like you said, lots of people, we still don't know what it is like to be lived with diabetes.
And a long time ago, or not a long time ago, I've been doing this quite a little while, but back when I first started as a diabetes educator, it was very strict. It was very much like you have to eat this, and you have to eat at this time, and this is how much you can have. It wasn't very flexible. And what's been amazing, I feel, through my career, is seeing all the medication changes, the technology that is allowing people to be like have a lot more flexibility, because I want people who have diabetes to be able to manage the diabetes, not the diabetes control them. So when you're talking about what food and rice as a staple food, like food is more than just food. It's culture, it's sitting down as a family, it's nourishing your body, it's so many things. Whereas if back a long time ago, it was very much like, well, you can't have that, and then it's very restricting, and then that would impact people's mental health a lot, that I would see in my clinical experience. So
it was very hard for family themselves to manage as well. But when I see, I'm thinking of Robin Compton, right? When I see her post, it's like, oh my God, why did we restrict it so much? Like when she shows that the ample amount of food that you can, the variety of food that you can have, and and it's really eye-opening for to have those kind of resources.
Definitely. And dietitians are great because they can do a lot of that. I love doing myth busting with food, because there's no such thing as a diabetes diet. So we just all can eat healthy and eat well and nourish our bodies and eat what we like, and everything in moderation. But as someone with diabetes that's not sure about that, if you've got diabetes, you go and see your diabetes doctor, your diabetes educator, your dietitian, to get that support to learn about those specific things, because it's so important to go to the source and learn those things, because there's lots of food police around, there's lots of diabetes police around that say you can't have this or you can't do that, and that's really impactful for people. Our words are so powerful. And what I love, that as an educator, that I can use my words for good, not for that diabetes food police, or that diabetes police type thing.
To restrict, to empower people, not about bringing fear, right? And that takes us to another question, that who is diabetes educator?
What is a diabetes educator? So
what is diabetes educator, like yourself?
So my primary, I guess, trade, I say, is I'm a registered nurse. So I've got a Bachelor of Nursing, and then I did a postgraduate certificate in diabetes education, so a 12-month course specifically in regards to diabetes management. Then you have your qualification, and then there is a process where you can become credentialed. So that's with the ADA, the Australian Diabetes Educator Association. So there's it's quite a lot of paperwork and things to complete. So in terms of modules and just excuse me, learning more about specific things with diabetes. and having that experience and continuing that professional development, then you are able to get a mentor, and you work with that person for at least 6 months to, it's sort of like a grad year to sort of move then into that space of specifically being a support for people with diabetes, to learn, to teach people how to look after their diabetes and manage it. We learn about medications, insulin, technology, all of those sorts of things. So it's quite intensive, lots of things to complete. And then every year we have to complete a certain amount of professional development points or study, and then every year you have to maintain that qualification. So it's very intense, and lots of things to do. But of course, you need to have those skills and that knowledge to be able to then support people safely as well.
Yes, because everything is changing. Health is changing so fast, right? Like everything else, like health, and and the things it impacts, and the time is changing so fast. So trying to keep up with it and be able to provide the service that matches to that change to the public. And
I remember when I had my son, I had, I think, nearly 11 months off, and I think 2 insulin pumps had come out, and a new sensor for glucose monitoring had come out in just that short amount of time. So the technology is changing rapidly, which is amazing. But there's so much to learn and keep up with, and that's what's really important, to be able to maintain that knowledge, to then share it, to keep people safe in the community.
Yeah. Did you say your son used the insulin pump?
No, when I was on maternity leave, when I had maternity leave with him, I wasn't at work for, I think, nearly 12 months.
Oh, yes.
And two pumps and a different sensor had come out onto the market. So that's how quickly it's changing. Yeah.
Wow. Okay. So we better keep up with it, hey? And so how do you, as we are in a women's health community, we wanted to talk about how do you support women in diabetes world?
Great question. The thing that comes first, obviously, is gestational diabetes, or diabetes in pregnancy. So diabetes doesn't just affect women, it affects men, obviously, as well. But in that female space, gestational diabetes is a big workload. Supporting women through pregnancy with that is very important. I feel very privileged to be a part of any lady's journey with diabetes in pregnancy. I will support women who have type 1 diabetes or type 2 diabetes in pregnancy as well. So there's 3 different categories, like sort of subsections alone in pregnancy.
Yes.
I support lots of mums as well. So lots of mums with little ones with diabetes.
Yes.
I see lots of teachers, lots of partners, lots of grandmas as well. The carers, the people who care for people with diabetes are a huge work amount of work that I do as well. So it's not just that person that has diabetes, because that we've got lots of people in Australia with diabetes, but we've got people that know that person. They're a mum, they're a sister, they're an auntie, they're a granny, a nana, a teacher, a neighbour. So I see lots of different people that support diabetes differently and that are impacted by different ways, if that makes sense. I'm getting a bit tongue-tied, but again, that comes back to that theme of Diabetes Week. Like, one voice is great, but if we have hundreds and hundreds of voices for that person with diabetes, that's just huge, and it's amazing. So I feel very privileged to support anyone.
Yes, I can imagine that. And with the family and then carers knowing more about diabetes as you educating them, it would be so much, they would be caring for the people with so much compassion and care and love, right? Or you would care for your family members no matter what, but when you understand better, then I guess it would be easier for them to take care of them. Like for me, I didn't know what to do for my grandfather, because we couldn't have the main staple food. So, poor thing, he was always so worried that because we had only GP, but the GP would say, okay, you have sugar, so you cut out all the carbs. And our food is carb loaded food. And so it was a very, but once you have the educator and then, you know, all the support system, and I think that just breaks down all those barriers. And it's not only for that, the specific person who has it, but the family who are caring. It would be not calming, but it would be reassuring that, you know, how to take care of them.
Yeah, yeah. And if you think about, if you have a health condition and it's something that you can't see, it's silent. It's something that
Mm,
a lot of people have said to me that they just feel very alone. So having
mm,
those people around to help and support and advocate, like if anything, I'm more of an advocator for a lot of people who've had type 1 diabetes for a really long time. I
mm,
don't need to educate because they do an amazing job with looking after themselves, but often it will be, no, it's okay. Like if you're in hospital, I will come and I will advocate for you to do your own injections or have your blood glucose machine out and
mm.
things like that. So a lot of it is that advocacy. And if you think about when you are sick and in hospital, it's
Mm,
you're very vulnerable. And if you're
yes,
unwell, you have to be really, really strong to advocate for yourself and have your voice heard.
yes.
Excuse me. So to have to be brave and have a voice about your health condition and then have other people on your side, it's a
Mm,
big force to be reckoned with. and
yes.
and so it should be. We should all have voices that are heard and listened to, because what
Mm,
people live with all day every day for sometimes a really, really long time, that
yeah.
they have to be heard and feel validated, because that is who they are. Yeah.
Yes, yeah. I was looking at this, I think it was in, I can't remember whose post, because I'm researching on diabetes this week and looking at all the professionals' post. And it said that in that post, it said that, you know, it is not your fault, you know, because I think with diabetes, it has lots of shame involved in it because you ate such and such, or you ate too much sugar, or you did this, or you did that. That's why you got diabetes. What would you say to those people who are feeling a bit about, you know, a bit confused about that?
Yeah. So great point, because there's a few different types of diabetes. So we've got type 1 diabetes where the
Mm-hmm.
pancreas is not making any insulin at all. It will just stop. And there are a few theories around that. But whenever I see someone who's diagnosed with type 1 diabetes, often the first thing I will say that this is not your fault. You have done nothing wrong.
Mm,
And there's lots of ways we can manage it, but you're allowed to feel upset and shitty, excuse me. But
mm,
I will be really real like that, because it's people do blame themselves, or families might blame
mm,
themselves. And again, I feel really privileged to be a part of that, but I that's something that I will always say straight away, that you have done nothing wrong to cause this type 1 diabetes.
mm,
Type 2 diabetes is a little bit different. So type 2 diabetes is where the pancreas is still making insulin, but just not enough.
mm,
That does have a big genetic component and a lifestyle component. But again, I'm never ever going to blame anyone for anything. That's not how I educate. That's not who I'm as a person.
mm,
But a lot of those feelings are very valid for everyone at any diagnosis of diabetes. So it's just part of that processing and that acceptance, like
mm,
that process of that. But I will reassure people that, yeah, they're allowed to feel what they feel, and that I'm there for them, and I'll hear them when they need to be heard, and that I'm there when they're ready to tackle it and help them
mm,
be strong and brave. But you can have good days, you can have bad days, you can have really shitty days. Sorry, I swore
mm,
again. But it's there's no reason to blame, and
yes,
everyone's different. So yeah,
yeah,
I just meet people where they're at to support them however they are ready to
mm.
feel supported. Yeah.
Yeah, because shaming people, and they already has so much going on with the, you know, if they are just diagnosed with the diabetes and be feeling shameful about themselves. On top
Hmm.
of it, if you are starting to say, you know, or because you might have done this, that, and that is not really empowering, is it?
No,
And
not at
it is
all.
going
Not at
to
all. Yeah. And we have
be,
lots of people out there that will say, like the diabetes police, I call them, because it's like, you can't have that, or you can't have um, little one can't come to a party, or can they have cake at the party? And it's like, they this little person can have whatever they like. It's just about measuring and taking a few extra steps to work out insulin or medication dose to be a part of that, because that's more important, that that little person feels a part of that party or a part of school than feeling shame about what their diabetes diagnosis is. We need to be inclusive and not exclude, and yeah, our words are so powerful. So I love that the campaign this year is just being together, shouting out loud, and spreading what people with diabetes wish people without diabetes knew about their condition, because a long time ago we were all very separate. And when I say separate, like I went to a conference last year and it was amazing, because there was people on stage presenting who had a lived experience of diabetes. There was people from research backgrounds. There was people from hospitals and GP and community and schools, and everyone, we were all there for the same reason, for that advocacy and spreading that knowledge is power. And that's why I love this year's theme, because it is say it loud, say it proud, and just be together, share together.
Yes.
Spread the news together.
Yeah, I wanted to go back to when you said that when the other families, they don't know what the diabetes is or how we can be inclusive of the that child or the other family members who has diabetes. So, or we can say that they just have to measure how much they can eat throughout the day. Can you clarify on that, so we know that, you know, the person is like, oh no, they can't have the cake at all, or, you know, no, I know how to manage it. They know how to manage it. So they have, how do they manage it?
So I think, going back to the first part of your question, I think just being curious. So I think for little people, for example, I've known little people to be newly diagnosed with diabetes and go back to school, and they might do like a show and share at school, or they might show their classmates their insulin pump or their insulin pen needles. And kids are very curious, but kids are, they don't, especially the little primary school ones, they might not know much. So they'll just say, hey, what's that? Or what's on your arm? Or is that for your blood sugar machine? Or is that an insulin pump? And then that little person might be really brave and show their classmates their insulin pump. And then it's a beautiful thing to see all their little classmates like come together and just say, oh, this little person, like, they need help, or they might need some sugar if they're a bit low. And I think kids are really curious, and I think as adults we can just be curious as well, and not assume. And if you meet someone with diabetes, or coming across someone with diabetes, and go, oh, is that a pump, or is that a sensor? Or they might say something to you about diabetes and go, oh, I don't know much about that. Would you feel okay to share? Or I think just being curious is probably the easiest way, because you might not know someone very well who might not want to share as well. But then there's lots of other people that might want to be really loud and proud about it. So I think just being curious, engaging where someone's at, and meet them where they're at, and go from that point of view, and not be that you can't have this, you can't have that, because it's very old school thinking. But again, everyone's different. So I think just be curious. I think that's probably the best way.
Okay. Just asking question, and just ask, right? I don't know much about it. Can you? Would you
set me straight?
Would you be open to share about it? All right. Okay. I feel like we can talk about this for ages, but I'm just like curious, how would you know when someone come to the party, and if they have diabetes, so how would you approach, so it's always good to know. Okay, so any final words before we close this live?
I think I love my job, because I think as a health professional, I'm very privileged to have the knowledge that I do from the work that I do. But I think I learn mostly from the people that I meet, and the sharing that comes from the people that I meet. And I just love what I do, and I'm very, very privileged. And thank you for having me on today. Thank you for asking me to come and talk about diabetes for Diabetes Week. So I've learned lots at school and uni, but I learn mostly from the people that I come across, and I love that, and that's very valuable, and that makes me the educator I am, I guess,
Yes,
and
it's never
helps me
ending.
share what I want to share. No, never ending. Always learning. Always
Yes,
learning.
absolutely. Someone said that as soon as you think you know it all, you stop learning, and then you don't know anything at all.
Yeah, yeah,
So yeah,
definitely.
it's forever learning.
Yeah.
All right, okay. So before the crane is happening outside, so I'm sorry about that beeping.
That's okay. I've got to get to my athletics
Yeah.
carnival for my
All
kids.
right. Okay. Thank you so much for being here, Mel. And
Thank
if
you, Ange.
people wants to reach out to you, what's the best way to reach out to you?
Probably just through social media. So just on Instagram,
Instagram
on my
message.
Diabetes Educator Mel page. I
Okay.
work out of Nerang at a place called Connections.
Yes,
So
you still
the
there?
link is,
Okay.
yeah, so the
Yeah.
link is
Okay,
just,
cool.
yeah, on my social media pages.
Okay.
Yeah,
Awesome.
or
So
through your page.
yeah, so can I post can I add the connection what's the name again? The place you're working?
Connections. Yeah,
Yeah,
I'm sure
connections.
they'll be okay with that.
Yeah,
Yeah.
yeah, okay. All right. Thank you, Mel, for being here and all the amazing insights and leading the diabetes community with the compassion and care and education.
Thank
And
you.
yeah, and we will do this again next year.
Sounds good.
I better prepare the next year. I
No,
will.
you do fine.
Yeah. All right, Mel. Thank you so much.
All
Thank you,
right.
everyone, for
Thank
being
you.
here. And yeah, see you soon. Bye.
See ya.
Bye,
Bye.
Mel. Thank
See
you.
ya.
Bye.
Bye.